Cities around the Show Me State have adapted to the new normal of social distancing due to COVID-19. But that has us asking, what about the next pandemic? What can government and society do to be better prepared? Well, it's not as if government hasn't thought of these issues before. I hold in my hand a 2013 report from the CDC about the then 10-year-old SARS outbreak and what government learned and recommendations it made to deal with future occurrences like the one we're in now. Messages weren't heeded. So what can we do differently to make sure the next pandemic is one we're more prepared for? By now, you've heard politicians say that no one could have predicted the current medical emergency. That's simply not true, according to Dr. Georges Benjamin, head of the American Public Health Association.
We've had plans for pandemics for a long time. And in many cases, we're not following the plans that we have.
In fact, President George W. Bush released this report in 2005, calling for a coordinated government response to a potential flu pandemic. The report follows a similar theme as other government reports of the time. Bolster the Fed's medical supply stockpile, invest in public health staff, and coordinate at all levels of government.
My fingerprints are on a lot of those reports, I might add. And the fact is that we've had lots of changes in leadership. We haven't passed it along. Even the oral history for many of these issues have been lost.
Meanwhile, the strategic national stockpile of medical supplies is at the heart of criticism that not enough was done to prepare for the COVID-19 pandemic. But as ProPublica reporter Lydia DePillis tells us, the stockpile's purpose is a study in government priorities.
That was created back in 1999, actually to combat bioterror attacks. It was meant to deal with something more like anthrax. And its purview changed and expanded over time to have to deal with not just pharmaceuticals, but also all of the gear that you might need in an influenza outbreak.
The stockpile's expanding use also led it to wearing thin. And the White House blames the now sluggish medical supply ramp-up on the Obama administration, not replenishing the stockpile after the 2009 H1N1 emergency. But that criticism ignores two facts.
The Budget Control Act was passed, which forced a ton of painful cuts all across the government, and one of those was to the stockpile's request to replenish itself.
And Republicans who pushed for the 2011 Budget Control Act had unified control of Congress and the White House in 2017 and 2018, during which time this Congressional Budget Office report shows that government spending clearly increased. Spending on replenishing the national stockpile and bolstering public health could have been handled then. It wasn't. But it's not just the feds benefiting from hindsight in all of this. Across government, keeping medical supplies at the ready often took a back seat.
New York City did this too with their own stockpile, is that they weren't properly maintained, and then they auctioned them all off. So you need to keep intense focus on preparedness, even if the possibility of this kind of event seems increasingly remote.
So, looking ahead, if preparedness is the name of the game, how do we effectively predict the future of medical emergencies? Well, one thing I learned in filing this report is that my question at the top of this segment is misguided. We should avoid the temptation to fight the last war, or in this case, pandemic. Dave Dillon from the Missouri Medical Association explains.
You know, the reason that we don't plan specifically for pandemics is because the next crisis may not be a pandemic. In about 2005 or 6, we purchased a lot of equipment and supplies. Much of those ended up in warehouses and have expired historically because we did not have an event that necessarily needed those specific resources.
So the key here is actually not to focus intently on the next pandemic, but to prepare our public health system for any and all health threats. The key is continual personnel training and practice in contact tracing, logistics, and capacity building. The act of writing reports and running tabletop exercises alone won't cut it.
We absolutely need to build a functional, sustainable public health system for the future. And I'm talking about the governmental public health stuff that occurs long before people get to the hospital. That's the first thing I would do. I would spend a lot of time and effort and money in preparedness training and requiring that we do it as a matter of course. You know, the reason that we do very well with cardiac arrest is because we've all had CPR training and ACLS training and ATLS training, and we practice it all the time.
And ProPublica Health reporter Caroline Chen points to the need for public health investment across government.
The CDC has to have the ability to talk to the states. You know, some of them are still operating on phone and fax. So even the ability to get data from a state level health department, from what they're seeing, you know, the amount of emergency room visits, and be able to expeditiously, with the latest technology, get that data back to the CDC, for example. You know, personnel, something as simple as having enough salary that they can hire all the staff that they want and hire the best epidemiologists. You know, having the budget to have as much PPE as they need, you know, when they need that PPE. You know, even that sort of thing, which sounds so basic, is necessary. And to not have budgets get cut during the peace times, quote unquote.
But peacetime spending isn't what it used to be. The government is now on the hook for trillions in economic stimulus related to the COVID social distancing policies. While good for public health, this isn't sustainable spending policy, says Adam Millsap, a senior fellow at the Charles Koch Institute.
I think you're right that we're going to have to reckon with this. What does that exactly look like? I think we're going to need to have we're going to need to dust off maybe some of the bipartisan agreements or bipartisan plans that have kind of come up in the past. The Simpson-Bowles plan, for example, getting into 2021, the summer of 2021, the spring of 2021, after the election, we're going to need to start thinking really hard about how can we get the deficits under control in order to bring down the long-term debt to something that's more reasonable and more sustainable.
Being prepared for the next health crisis will mean keeping public health a top social and government priority, something Dr. Georges has said all along.
I'm going to continue to tell people we told you so.
Brian Calfano, Ozarks First.